Hello and thank you for watching this video on emergency bleeding control, control a bleed, save a life. This video is brought to you by Pecos County EMS. Before we begin, there's a little bit about myself. My name is Abel Galindo. I work here at Pecos County EMS. I'm a State of Texas Department of State Health Services EMT paramedic. I'm also a nationally registered paramedic and a certified flight paramedic. Here at Pecos County, I'm a captain and a training officer. For the American Heart Association, I'm a BLS, which is CPR and first aid instructor, and also an amateur pool player, but emphasis on that amateur part. So when you're talking about controlling critical bleeds, a common question is, but why me? Doesn't EMS get paid to stop bleeding? And while it's true that EMS professionals are skilled at controlling hemorrhage in the pre-hospital settings, and yes, we do get paid for it, oftentimes we're just not fast enough. The average response time from you calling 911 to an ambulance showing up at your door is approximately 6 minutes. Someone with a critical bleed can actually easily bleed to death in 5 minutes. In 2015, the White House initiated the Stop the Bleed National Awareness Campaign to help educate the public on bleeding control. This presentation is an abbreviated version put together by us here at Pecos County EMS to bring awareness level knowledge to as many people possible in the shortest amount of time possible. So some notes about traumatic bleeding. Trauma is the leading cause of death of people under 46 years old, and uncontrolled bleeding is the #1 cause of preventable death from that trauma. In a safe environment, the closest person to the injured person is best positioned to stop the critical bleed. So by increasing the number of people who know how to stop critical bleeding, we're trying to increase survival rates. And just something to keep in mind is you are the help until help arrives. So if you see something, do something. So just like anything else, safety first. Your safety is the #1 priority when helping others. You don't want to turn one patient into two, the second patient being yourself. So look for any hazards on the scene that may pose a threat, such as broken glass or other sharp objects, down electrical wiring, or assailants at the scene, or people with weapons. Be sure and wear gloves to protect yourself from infection. If the blood is spurting, you may want to consider eye protection as well. Only enter an area if the scene is safe. You can't help anyone if you get hurt as well. And if the scene becomes unsafe, immediately remove yourself and the patient if possible from the scene. The next step would be to call 911, get help on the way. You can call 911 yourself or direct somebody to call 911 for you. If you need to use both hands and nobody else is available, you can use your cell phone speaker mode to talk with the dispatcher while you're doing work out there. Remain calm while speaking to the dispatcher. Tell the dispatcher what is happening and where you are, and answer all the dispatcher's questions, and try not to hang up until they tell you to do so. Have someone else talk to the dispatcher if anybody is available. An important step to stopping a bleed is identifying the life-threatening bleed. So not all wounds are created equal. Here in this picture on the slide, it shows the difference between arterial bleeds, venous bleeds, and capillary bleeds. So you can see that the arterial bleed has splurting bright red blood with a pulsating flow. Venous and capillary bleeds are more of a steady, slow flow and darker blood. So only major life-threatening wounds should get packed or have a tourniquet placed. While looking at a wound, trust your instincts. If it looks like an alarming amount of blood, it probably is. Most common wounds can be stopped with direct pressure. Remember not to take off the gauze or cloth once it's been placed on the wound. If the wound continues to bleed through the cloth or gauze, just add more cloth or gauze until the bleeding stops. So life-threatening bleeding consists of blood that's splurting from the wound, indicating an arterial bleed, large amounts of blood pooling on the ground, clothing or bandages that are soaked with blood, or blood that won't stop coming out of the wound. Okay, so now what to do. And we will include videos and demonstrating how to do all these skills later on in the presentation. So say you do have a trauma first aid kit. For life-threatening bleeding coming from an arm or a leg and a tourniquet is not available, or bleeding from the neck, shoulder, or groin, you should pack the wound with either bleeding control gauze, which is like hemostatic gauze, like quick clot. Plain gauze will work, or if you don't have gauze on you, a clean cloth will be fine. And then apply pressure with both hands. So step by step, you're going to want to open the clothing over the bleeding wound, wipe away any pooled blood, and then pack or stuff the wound with either bleeding control gauze, plain gauze, or a clean cloth. Be sure and apply steady pressure with both hands directly on top of the bleeding wound and push down as hard as you can. Hold pressure to stop bleeding. Continue pressure until relieved by medical responders.
Okay, so in this scenario, it's going to be whenever you have a trauma first aid kit available and you have a wound in your arm or leg, neck, groin, or shoulder, and a tourniquet is not available. Okay, so in the first aid kit will probably be gauze. This is 4x4 gauze and this is roller gauze. So what you're going to want to do is you have all your personal protective equipment on. And then you're going to wipe away all the extra blood from the wound, and then using the roller gauze, I usually try to make a little ball. Then once you have the ball, you stuff it into the wound. Then continue to pack the wound as much as you can using the gauze. By doing this, you are creating pressure, direct pressure on the wound from the inside. And then once the wound is packed all the way and you can't fit any more gauze on there, then you'll apply pressure from the outside with both hands. And what you want to do is apply direct pressure and then continue to hold pressure until medical personnel arrives.
So for life-threatening bleeding coming from an arm or leg and a tourniquet is available, you can go a different route. And that's, of course, applying a tourniquet. So in order to apply a tourniquet, you wrap the tourniquet around the bleeding arm or leg about 2 to 3 inches above the bleeding site. But be sure not to place a tourniquet on a joint. If the area 2 to 3 inches above the bleeding site is a joint, just go above the joint. Then pull the free end of the tourniquet to make sure it's as tight as possible and secure the free end. Twist or wind the windlass until bleeding stops. Secure the windlass to keep the tourniquet tight, and then note the time the tourniquet was applied. And just remember that a tourniquet will be painful, but it's necessary to stop life-threatening bleeding.
Okay, so this scenario is if you have a wound in the arm or leg and a tourniquet is available. Okay, so this is what's called a cat tourniquet, and we'll say that this is our wound here. These are really easy to use. All you do is unwrap the tourniquet, it's all Velcro, then put it around the patient's, we'll say this is a leg. You're going to want to go 2 to 3 inches above where the wound is. Okay, so pull the tourniquet really tight and then secure it to itself. It's all Velcro, so it secures real easy. Okay, so we're about 2 to 3 inches above the wound, and then just start tightening. This is what's called the windlass. So after a few turns, you're looking to see if the bleeding is slowing or stopped. Once the bleeding is stopped, then you secure the windlass in this little C thing here, and then you can cover that with this. And on here it has a time for you to write down what time you applied your tourniquet on. And that's how you apply your tourniquet.
Okay, so say that you don't have a trauma first aid kit. That doesn't mean that you're unable to stop critical bleeds. All you have to do is apply direct pressure on the wound. Cover the wound with a clean cloth and apply pressure by pushing directly on it with both hands. So steps for this. Take any clean cloth, for example, a t-shirt, and cover the wound. If the wound is large and deep enough, try and stuff the cloth into the wound and pack it like we talked about before. Apply continuous pressure with both hands directly on top of the bleeding wound. Push down as hard as you can. Hold pressure to stop bleeding and continue holding that pressure until you're relieved by medical responders.
Okay, and this last scenario is if you don't have a trauma first aid kit and the person is having a critical bleed, this could be in the arm or leg, neck, shoulder, and groin. What you can do is get any clean cloth, so we have a t-shirt here, and use that cloth to put direct pressure over the wound. Now if the wound is deep enough and large enough, if you can try to pack it in there, then that works as well. So you can start packing the wound like we talked about earlier. Once you can't pack it anymore, then just put it over again, and again with both hands apply direct pressure to the wound and wait until medical personnel arrive.
A reminder that I wanted to add in is just remember that we don't pack wounds in the abdomen or chest. The abdominal and chest cavities are so large you'd be sitting there forever packing gauze into the wound. So for wounds to the abdomen, just direct pressure with gauze is advised. For penetrating wounds to the chest like a gunshot, place a dressing that air cannot pass through, like the inside of a sealable food storage bag. Okay, that's all of the presentation. Thank you so much for taking time out of your day to watch this video, and if you have any questions, our contact information is on the screen. Thanks and have a good day.